Hello students, in today's topic we are going to discuss about osteoarthritis. So osteoarthritis is a chronic degenerative joint disorder characterized by the progressive deterioration of articular cartilage, subchondral bones changes, osteophyte formation, and also joint space narrowing leading to pain, stiffness and functional limitation. So this is the definition of osteoarthritis. It is the most common form of arthritis. Arthritis is nothing but the inflammation of joint affecting weight bearing joints such as hip, knee, ankle. Signs and symptoms. So the symptom is joint pain, worse with activity, morning stiffness less than 30 minutes, reduced range of motion, difficulty walking, climbing stairs, joint instability or buckling. The signs are joint tenderness, crepitus on movement, swelling, mild diffusion, muscle weakness, especially quadriceps, gait abnormalities. Radiological features, X-ray finding, joint space narrowing, osteophyte formation, subchondral sclerosis, subchondral cyst, malignant, that is varus deformity in knee. The pathology. When we talk about the pathology, there will be loss of proteoglycans and collagens and cartilage. So these are the substances or the material where if you just overview the physiology of the joint, then you can see these structures of the proteoglycans and collagen will be lost in cartilage. Fissuring and cartilage erosion will be seen. Thickening of subchondral bone, that is sclerotic formation, also seen. Formation of osteophytes at the joint margins. Synovial inflammation, low grades. Common deformities, the joint and the deformity. If it's knee, then genu varum, bow-legged, genu valgum, less common. There is nothing then inversion. Gum, the word gum, it means inverted, varum means everted. Hip, fixed flexion deformity, external rotation. Ankle rare but may show instability or altered gait due to compensation. Medical management. Analgesics, paracetamol, NSAIDs, topical agents, diclofenac gel, capsi, caps, capsi, capsaicin cream, intra-articular injections, corticosteroids, short-term, hyaluronic acid, controversial. That is disease modifying OA drugs or glucosamine, chondroitin sulfate, limited evidence. Surgical management, surgery and indication, orthoscopic debridement, and in mild cases, in mild OA with a mechanical symptom, osteotomy for the young patients with malalignment, hemi or the total joint replacement, THR, that is total hip replacement, and TKR is total knee replacement. Severe pain, deformity, loss of function is then we can go for this. Ankle orthodesis or replacement in the stage ankle OA. Physiotherapy assessment. Components and description. When we talk about the pain, will describe with the VAS. When we talk about the range of motion, active and passive, it's involved. Muscle strength and manual muscle testing, MMT, especially quadriceps and gluteus. Gait for limbing, instability or altered mechanics we can measure. For posture, checking for the compensation patterns. Functional test, sit to stand, 6-minute walk, and also stair climbing. Physiotherapy, aim and management. So the aim for OA is to reduce pain and inflammation, restore joint range of motion, strengthen supporting muscles, improve balance and proprioception, delay progression and improve the function. And also management technique, the technique and purpose. If we give hot pack, the purpose will relieve pain and stiffness. Ultrasound and tends to pain modulation. Range of motion exercise prevent contractions and maintain mobility in case of OA. Even OA can also lead to contraction. Strengthening focus on quadriceps, hip abductors, gluteus. Stretching hamstring, calves, hip flexors. Balance training. Prevent falls. Gait training, normalize walking pattern with or without aids. Weight loss education, reduces joint loading. Hydrotherapy, low impact exercise in water. Home exercise program, HCP general instruction, perform exercise daily or weekly or at least 5 days a week. Use pain as a guide. No exercise in acute flare. Avoid high impact activities. Use supportive footwear or orthotics. Next is osteoarthritis of knee or knee. For the knee, what we'll be giving the home exercise protocol. Quadriceps strengthening, isometric. Quadriceps strengthening. It's an isometric exercise. Sit with the leg extended, press knee down against the towel. Hold 5 seconds and repeat it for 10 times. Straight leg raise. This is for knee HEP, okay? Lie supine, lift leg straight to 30 degree. And 3 sets of 10 repetitions, 3 sets. Hamstring stretch. Seated or supine. Hold 30 seconds and 3 times. Sit to stand practice. From firm chair, 10 to 15 repetitions. Step up on low step. Controlled ascent and descent, 10 rep per leg. Osteoarthritis of hip, HEP. For hip, we are giving the home exercise protocol. Gluteus medius strengthening, side lying abduction. Rise top leg, hold 5 seconds, 3 sets into 10 repetitions. Hip flexor stretch. If it's hip flexor, standing lunge or prone stretch. Hold 30 seconds into 3 times. If it's bridging, lie supine, lift pelvis, strengthen the gluteus. Standing hip extension with resistance band, 3 sets of 15 repetition. Okay. Balance training. Balance training, single leg stance. Hold 15 to 30 seconds, 3 sets. Osteoarthritis of ankle. For ankle, what we'll be doing? Ankle range of motion, alphabetic exercise. Draw alphabet with the toes 2 times per day. Heel raises. Standing on both the legs, rise on toes, 2 sets into 15 repetitions. And towels crunches. Curl towels using toes. Improve intrinsic foot muscle. Ankle mobilization with the band. Dorsiflexion, plantarflexion, 3 sets into 10 repetitions. Gait training. Practice heel toe walking and safe ambulation. So, let's end this video by summarizing. Definition of OA, that is osteoarthritis. It's a degenerative joint disease. Symptom will be pain, stiffness, reduced range of motion. And in radiological, joint space narrowing, osteophytic formation can be seen. Pathology, cartilage erosion, bone remodeling will be pathology. Deformities of genovarum, hip flexion, ankle instability. And medical treatment, what will be giving us NSAIDs, intra-articular injections. Surgical arthroplasty, osteotomy can be proceeded. Physiotherapy goal is to relieve pain, strengthen mobility. Home exercise protocol tailored for knee, hip, ankle with strengthening range of motion, balance, focus. Hope you guys have learned something new in this video. Stay tuned. Happy learning.